Yes, frenotomy rates are soaring around the world, particularly in Australia and Canada and the US. I believe the rates are soaring because our older studies have shown some benefit. Despite the studies being rated as poor on a research level, they've been shown to reduce pain during breastfeeding, and mothers' perceptions of breastfeeding are better after frenotomy. So what's happened is, because we have limited research and we have limited skills to support breastfeeding, diagnosis has increased. So as diagnosis has been increased, that has been associated with many breastfeeding problems that have other causes. And frenotomy is seen as a simple solution. So I believe that is driving the referral for surgical division of the frenulum. The professionals that are referring for frenotomy, there's a recent paper that's actually shown that most of the referrals are coming from what's called a certified lactation practitioner, which means these are professions like midwives and child health nurses, and we're even seeing in our part of the country alternative health professionals such as chiropractors and osteopaths. These people have limited training in lactation and of course limited experience in assessing or doing a comprehensive assessment of a breastfeeding session. So I think that's problematic. I think our results show that it's really important that mothers are assessed by a lactation consultant or someone that's extremely experienced with breastfeeding, because the symptoms associated with tongue tie are very common to other problems with breastfeeding. Mothers report pain when they're feeding if the baby has a tongue tie, or not all of them obviously, because many mothers can feed babies that have tongue ties and have no problems. There are many causes of that: infection, vasospasm, high vacuums. For some reason the babies suck quite hard. So therefore, if we look at pain, it's very hard to measure, but there are multiple diagnoses, and these should be checked off, if you like, or investigated prior to moving to frenotomy. I would advise Sweden, who apparently has very low rates of frenotomy, to really look at the way they're assessing the infants that do go for frenotomy. And clearly you have a very good assessment program and approach to breastfeeding problems, where frenotomy is probably the last of a long line of interventions. And I think it can be reassuring that your high breastfeeding rates are better than many global breastfeeding rates. Social media and the internet, whilst it brings a lot of information, it can drive an extreme view. And so mothers, we do know that mothers look to social media and the internet for information and sometimes self-refer. So I think if we can provide information that frenotomy should not be performed without that comprehensive lactation consultant, and get that into the internet and onto social media, and have mothers pick that up, that success after frenotomy is not guaranteed without knowing exactly what's going on prior.